Dr. Ravi Singh. I have been at TrustPoint when it's opened, and I have the honor of admitting the first patient in this hospital. So that's a privilege. So it has been almost 8 years now. It is starting ninth year will be starting soon. First of all, we need to find out what is going on, what are the circumstances, and what depression means. Depression means different things to different people. So what is they are not eating good and not sleeping good, they are withdrawn, they are not talking to their loved ones, or they stop going to church, or sleeping too much. So we need to find out what is going on, and then we have to probably seek some help. And especially professional help will be a good idea. Start off with the primary care doctor or therapist, where they know. The major depression or depression we start off with the sleep is number one thing. Interest, they're losing interest, feeling guilty about anything, having any psychomotor agitation or retardation means they are hyper or withdrawn, and concentration issues, they are not able to concentrate, and not sleeping. We already talked about any thoughts of hurting themselves, or don't want. They may not say they want to hurt themselves. They may say that, especially in the population I treat, they don't say that. They say they just don't want to live. They have no fun left in their life. So those things we need to look for that. That's especially in the older population. The problem is that it's very common. It's become common, and they don't want to use the word depression. So we need to start think about, ask them one other way around. What are you watching your show? You've been watching, or you've been reading the books? You've been magazine, or you lost some interest in that, or something happening? Are you sleeping? Not sleeping good? Something bothering you, or say, so this kind of thing, you need to start probing what is going on with that. That's how we start off, and then that will probably lead to some answers. That's why, especially this COVID-19 has got a lot of problem, and we have issues in my office and here too. That patients are afraid that they will get it, or they already had it, or something like that. So as much as you can assure them, we have to be, this pandemic is definitely, we have to be fearful, but we should not be overwhelmed with it, that we freeze. That will make it worse. So that's what we have to, our loved ones, we have to convey the same message. Don't get freeze. You have to be fearful, and to be fearful, but in a good sense, that you have to take all the precautions, mask, washing your hands, not keeping a reasonable distance. What is now 6 feet? Sometimes it's 6 feet, sometimes it's 8 feet. So something, whatever CDC says, we need to follow that. Yeah. That, like we have my patients in the nursing home or assisted living. That's become a problem. The video chat, if they are in some place like facilities like long-term care or assisted living, then maybe staff can help with the video chat, or they can go out. They don't come inside the building, but outside their window they can talk, visit, or get the phone calls more frequent. Make sure that you stay connected with them. They know that why you are not able to physically come and see them. The first of all, call us. If you have locally, you have any issues, call us. We are here. Our access department is there 24/7. And then again, I said before, talk to your primary care physician or your clergyman, and keep connected, not only materially but spiritually also. Keep connected. Make sure that you have been talking to your preacher or pastor or whoever clergyman is, that keep connected with them too. Before you take care of someone else, you have to take care of yourself. So make sure that you don't get overwhelmed with this COVID-19 issues, and you make sure you're exercising, eating right, and if you are on any medication, taking your medication, keeping in touch with your healthcare provider. That will be the best thing. First thing, you take care of yourself, and then you will be able to provide the best care to your loved ones too.